Welcome to my mini micro lecture. I'm going to take you through it really super quick as we conclude our meeting. And so I'm going to share my screen. This is my micro lecture, and its learning objectives are to define, explore, identify how to do a screening tool for treatments. When you're doing a screening assessment, you want to be respectful, non-judgmental, attentive. You want to motivate the client to identify their needs. You want to let them know there's no consequences to this and establish trust and develop rapport through an empathetic, warming environment. So what is a screening assessment? It's generally a 20 to 30-minute process, and it's a series of questionnaires to determine an outcome of symptoms and relevant history, age, demographics, needs, really what they need. And so, for example, you want to encourage a screening for mental health issues. Does this person have anxiety? But in this case, in Introduction to Substance Abuse, we are focused on screenings for substance abuse. So this is what a screening essentially looks like. I got it off the National Institute on Drug Abuse through USA.gov. And it asks questions like, in the past year, how many times have you used tobacco? And you would, depending on the client's needs, you would click, say they said, I use it weekly or more. Then you would click weekly or more, and it would take you to a whole big assessment that shows what the next steps are, suggestions, resources, and there's all different types of ones. Like the BSTAD is a teen screening for basic drug abuse like alcohol, marijuana, and tobacco. And then there's lab tests like urine samples and brief interventions. They're all a sort of series of questionnaires minus lab tests, but they all come out the same with different substances depending on the individual. So I just explained how to use a screening tool. So you prepare through an empathetic and a warming environment, trust, report, you screen, and then you act. And providers should use tools that best suit their practice. So when you act, you want to look at the next steps, treatment approaches, treatment plans. Does this person need therapy? Should their family be involved? And always, always get consent. Medication assisted treatment. This person smokes, so maybe we should try a nicotine patch and follow up on in 2 weeks or a month and see how they're doing. Encourage them to develop goals and plans for themselves, and then give them a list of resources. There are plenty resources out there, and I know I didn't physically demonstrate a screening tool, but I hope you understood the little that I did go over. And these are my references where you can find tons and tons of resources. The National Institute of Drug Abuse, again, is a great tool. You can pretend to be a client or you can pretend to be the clinician and it's a great way to practice your counseling skills if you're going to be a counselor in the future. So, like me, I did an overview of screening, and Snipes at YouTube gives you a more broad version of screening. And I hope you enjoyed my lecture, my presentation, and thank you so much for your time.